adapt. With passage of time, there has been a lightning change in technology, and we have very well adapted to it, also to the changing social norms. And so it becomes imperative on the part of gynecologists and doctors in general to bring light upon, to talk about, to focus upon certain topics which so far have not been talked about enough in comparison to the impact they have on our daily life, that is sexual dysfunction. Friends, you'll be surprised to know that FDA has identified sexual dysfunction as one of the 20 most affected areas which need a lot of focus and high attention. Despite all this, even today, any individual affected by sexual dysfunction will not reach out to a doctor. We need to look into this. They would still use OTC products, the red Korean ginseng, the maca, the euhomibine, and ginkgo, unaware of their serious side effects. Dr. Sunil Jindal and Dr. Ragini Agrawal have shown us that it is counseling which is most important. The history taking is the next step. The investigations and the treatments are so very cost effective, yet it is not reaching to our friends, to our fellow humans. It is not so bleak, friends. We have still a very good lot of things in store in the future. They are in the nascent stage. However, role of PRP, role of stem cell therapy, role of vascular implants, shock wave therapy in the treatment of male vascular dysfunction, and in female vascular dysfunction, Dr. Ragini has pointed out the role of pelvic physiotherapist, role of the new drug approved by FDA, that is flibanserin and bremelanotide, and a word about. So while just browsing about this topic, and thanks to Dr. Vani, I would have never bothered to read about all this, but thanks to her, I realized how important it is, because it is a very important part of fertility and the emotional and physical well-being of an individual. So women who are in long-term OCs, they raise SHBG levels, decrease the testosterone level. So though the total testosterone level is high, but the free testosterone level is low. The vulval vestibule is rich in androgen receptors, and these women experience a lot of pain because of deficiency of testosterone. So friends, do keep in mind, like both our excellent speakers have focused upon a very detailed history taking and the questionnaires. So that's all. Thank you so much to the organizers. Thank you to Dr. Vani. It's all yours for the next question answer session.
Thank you, ma'am. With the chairpersons, if there is any questions, ma'am. Otherwise, I will take the questions from the public side for Ragini ma'am and Sunil sir.
Yeah, I think we can take the questions, Dr. Vani. We can take from the chat box the questions. Yes.
Yes.
Okay.
Yes.
So first question is for Sunil sir. Sir, there's a question that how often the ejaculatory dysfunction is a sign of something serious. Sunil sir.
Any ejaculatory dysfunction is serious for any man, as long as you feel that it is important. Well, a premature ejaculation can be very dysfunctioning. It can be very frustrating, and it can be very bad on the ego of the man. And retrograde ejaculation, if there is any, will definitely lead to another problem, not only psychological, but also a problem in the fertility part of it. And very rarely you have retarded ejaculations, which becomes a very big problem for the family as well as for the wife and also for the relationship. So any ejaculatory problem is a problem.
Okay, sir.
I think Dr. Jindal, she wanted perhaps to speak, the question here was regarding the cardiovascular risk.
An organic problem, any organic
Yes,
problem,
cardiovascular
any
risk
organic
and
disease.
ED.
Organic problem, you mean?
Cardiovascular risk.
Any systemic disease, sir, any systemic disease or like that.
50% of men who have a cardiogenic problem after the age of 55 to 60 have erectile dysfunction.
Yeah.
I'm talking of erectile dysfunction. You had asked me ejaculatory dysfunction.
Yes, sir.
Yes. So I had spoken earlier about ejaculatory dysfunction. Now about erectile dysfunction, I had also shown a slide where they correlate beautifully about 6 things.
Yes.
They correlate the dyslipidemia, the chances that you would have a major cardiac event within the next 3 years is very high in case you have erectile dysfunction. Dyslipidemia, you have erectile dysfunction. 25% of people over the age of 50 who have hypertension have erectile dysfunction. The cells are endothelial in the penile sinusoids as well as in the heart, and both areas atherosclerosis takes place.
Okay, sir. Thank you, sir. The next question is for Ragini ma'am. Ma'am, there's a question that what is the load of female sexual dysfunction in Indian society?
It is a very, very difficult question because Indian women, we have no data, number one. But what I can say in my practice, which you can all think if you think of your practice, around 30 to 35% women are suffering some type of female sexual dysfunction. Maybe they are not happy in their relationships. Many are having pains or comorbidities, and especially the group which I can say coming to me more with this type of problem and little bit vocal, that is between 35 to 45. And this group of the women who are educated, who are independent, and who knows that sex is important, and many a time they are not married or they are divorcee within relationships. So these type of women comes and they please share the type of problems. I will certainly like to share one episode with all of you. This lady came to me with a simple vaginitis. Her problem is only vaginitis. But the body language is like this, she is not able to go from my chamber. Then I asked to her, and came out she is in an abusive relationship, one relationship, second relationship, and mind you, she's on a very educated, highly qualified, highly placed and moneyed woman of a 32 years old. Matlab, she has a money from the family. Like kisi dhang se, there was no less, but she in an abusive relationship throughout the life. And she's not ready to come out because she has so much insecurity inside. So many a time, this type of insecurity leads to a sexual dysfunctions, and in the abusive relationship, you are not happy, then you become not a performer also. So, many a time, I can't say what's the load in the really in an Indian scenario, but it should not be less than 40%. What is my estimate, seeing my own practice?
Thank you, ma'am. Sometimes the women don't come up also. They don't come up with these problems also.
You have to take out the history from them.
Thank you, ma'am. Sunil sir, there's a question for you. Diet and lifestyle to improve the ejaculatory dysfunctions and erectile dysfunctions. So please unmute yourself.
Yeah, I have a talk in the evening by the Bombay Society where I'm going to speak about obesity and the sperm epigenome. And one of the major things which affects erectile dysfunction is obesity by 4 pathways. Number 1, what obesity does it changes the testosterone-estrogen ratio. So in these men, the testosterone becomes down, and the low testosterone and the high estrogen, because of the aromatization which takes place in the fat, it leads to erectile dysfunction. The second thing which happens is, these people who are obese, they have sleep apnea. And the sleep apnea is one of the major reasons for erectile dysfunction. Up to 70% of people who have sleep apnea have erectile dysfunction. If a man comes with his wife to you and the wife says, ये रात को बहुत खुराटे लेते हैं, नींद में करवटे बदलते हैं, नींद इनको रात को खुलती है, you ask her after that, do you have a relationship which is okay? She would say, there is erectile dysfunction, इनके साथ में मेरा relation नहीं है. So, number one, the weight has to be correct. It corrects not only the obesity, it also corrects the hypertension, it also corrects the diabetes. Hypertension, diabetes together affect erectile dysfunction. Your diet has to be alkaline, full of antioxidants. The role of antioxidants in erectile dysfunction is, I won't say proven, but in a lot of studies, it has come out as being very, very beneficial. So that is needed. So you need to have in your lifestyle smoking. Smoking is directly correlated by so many studies. So you cannot smoke. Tobacco, anything which affects the heart also affects the erection.
Correct.
So people are very much bothered about the heart, but they are more bothered about their erection. But they can't talk about their erection, and they always talk about their heart. So this is the story.
Thank you, sir.
In fact, I tell so many of my patients that the choice is yours whether you want to keep the mobile phone in your top pocket or you want to keep it in your trouser pocket. It is going to affect one of the two, and the choice is yours.
Correct. Thank you very much, sir, for the answer. Ragini ma'am, there are a lot of questions, but I
tell the answer also because both are important. For
Therefore, nowadays I tell them always keep a Bluetooth.
Yeah.
Okay.
Even I have this phone on a Bluetooth.
Okay, Ragini ma'am, I have two questions. I will club them both. Is there any effect on the female sexual this thing after hysterectomy? And one question is, if the patients with PCOS, do they have female sexual dysfunction? These are two questions. I have clubbed them.
Yeah. So coming to the hysterectomy, when hysterectomy is done, patient goes gradually into the menopausal transition of the menopause. Her estrogen, I can frame like this. First thing is hysterectomy. Most of the women after hysterectomy, they have a mental block that मेरा uterus निकल गया है, और mostly it affects their health in a way कि मेरे को अब uterus नहीं है, I am not a perfect female. One is a psychiatrist complain with them. And second thing, if it is along with the ovary removal or very early hysterectomy where ovary is going to the compromised in a few years, patient leads into the hyperestrogenic condition. And I think the half of the talk is for the hyperestrogenic condition only. When patient develop the hyperestrogenic condition, patient has a low desire, low arousal, the area is become thin, liable to be fragile, pain disorders also come up. So hysterectomy, my motto, I totally follow Dr. Sharda Jain in that way. Save the uterus, save the uterus. The uterus should not be removed just heck of that it is bleeding too much. There are so many things are available. And early removal of the uterus is very bad. It affects the patient and especially ovary. If you remove the ovary, not only patient become hyperestrogenic, patient loses whatever the testosterone she is producing in the menopausal age, and whatever libido, whatever the sexual insight she has, everything she loses with the oophorectomy. So if you are doing a hysterectomy when you are 55 years old, just don't remove the ovary, that one day she will be going to develop a carcinoma. Now second, coming to the PCO patient. Now PCO patient, the first thing is very important for them is the all body images for them. They are obese, they are having lots of issues like Dr. Jindal has said, they have sleep apnea, they have body image issues, they have obesity. So as such, if you say they have not directly have so much of the sexual problem or sexual dysfunction because of some reason, but it is more of the psychological reason they are not able to perform. And second thing is the infertility is very common in these women. This also play a role in the PCO patient. Hello, am I audible? Yeah. Okay.
Yes, ma'am. Yes, you were audible, ma'am, throughout. Thank you, ma'am. Sunil, sir, there is a practical questions that what is the solution for the problems of persistent ejaculation lasting for a longer time during the vaginal intercourse, and the partner is having a lot of pain and there is no ejaculation, and masturbation has to be done for ejaculation. So your insight, sir. So please unmute yourself.
Yeah, this is what is known as retarded ejaculation. And this is a very rare problem. It is not very common. And if this happens a lot of times, it normally has three issues to it. Either it has a neurological problem in these men, or it has a psychological problem. Like there are times when a man could have intercourse and ejaculates fast with one woman, but not so with the other woman. And the third thing is that the patient may be taking some drugs. And these drugs, especially drugs which are antidepressants, these drugs have two reasons, two methodologies of working. They also retard ejaculation. So his medication history needs to be taken, psychotherapy needs to be given, and these patients are very difficult to treat.
Okay, sir.
There is no drug for it.
These are the difficult patients.
Yeah. Can I take leave from you, because 7:45 I have to join another program.
Me too. Me too. I also have to go to
There are
another
lot of
platform.
questions, ma'am. Due to paucity of time, we will not be able to take all.
You can send us, we can reply.
Yes, ma'am. Yes, ma'am.
Yeah.
So this webinar is credited with one ICOG point. I thank Dr. Mandakini May, the chairperson ICOG, and Dr. Parag Biniwala, secretary ICOG. I thank our chief guest, Dr. Sharda Jain ma'am, for sparing this evening with us. I thank Dr. Ragini ma'am, Dr. Sunil sir for great insights and mystic lectures. And I thank my esteemed chairpersons, Dr. Dipti, Dr. Sunanda, Dr. Jyoti ma'am. And I thank all the viewers for patient viewing and listening. I thank my whole team, Dr. Neeraj sir, for having confidence in me. I thank the whole entire team, the support team. And last but not least, I thank God for making this webinar possible in times of COVID. Thank you very much.
Thank you so much.
Thank you very much.
Thank you.
Thank you.
Thank you,
To
Dr. Vani.
everyone. Bye bye.
Bye bye.
फिर मिलेंगे किसी और प्लेटफॉर्म पे.
Bye.
Definitely.
Sure.
Bye.
Thank you, Dipti ma'am. Thank you, ma'am.
Thank you. Thank you.